Can I welcome everyone this morning, and can I just say a particular thanks to those of you who have brought donations for the food banks partnerships within the city.
Everybody here has a role to play, and it will be through partnership working that we'll be able to better respond to those in immediate need, and in the longer term develop solutions that prevent or at least minimise the number of people who need to rely on food banks. There is, as I say, some serious work to do. Thank you very much. Thank you.
Following this research, the Poverty Alliance has been funded to run a series of 4 regional half-day sessions targeted at emergency food aid providers. These will be opportunities to share experiences, challenges and good practice. The sessions will allow groups to learn about key issues such as in-work poverty and welfare reform, help build the evidence base of the issues facing emergency food aid providers and the people they serve, and also hopefully to develop a collective voice and connect those organisations with wider anti-poverty campaigns.
For the first time, I was speaking to a colleague just before we started, for the first time in Scotland, the directors of public health are speaking out about this issue, and it's been described in the public health world as a public health emergency. And in March, beginning of March, the directors of public health for for Greater Glasgow and Clyde and for Lothian published a joint statement expressing concern about malnutrition and lowered life expectancy of children in Scotland due to food poverty and welfare reforms affecting their parents.
Stand in the other person's shoes. One of the great things about Ellen Kerr, one of the most marvellous human beings I've ever met, was she recognised that we should all always, nay immediately rush to judgment. We should stand in the other person's shoes and try to see the world through their experience and their eyes. And I think all of us should do that more than we do at the moment, because we're very quick to judge. The last thing is, and I think it's a depressing message, but I think we've got to take it on board. Beyond Food Banks has got to take it on board. The health people wanting folk to eat good diets have got to take it on board. We ain't seen nothing yet. It's going to get a lot worse, regardless of the outcome of May, in my view.
Hello, my name is Dave Simmers, Chief Executive of Community Food Initiatives North East. We are the lead partner in the Food Banks Partnership Aberdeen, which has 25 members. The Food Banks Partnership Aberdeen was set up to coordinate and bring coherence to food bank work in the city. We will have something in the order of 12,000 visits to the food banks in 2015. The partnership is committed not only to providing food, which in itself is not very helpful, it erodes dignity and creates dependency, but rather we want to refer and signpost people to other support round about employability, health and well-being and money advice support. It's a pretty shocking situation that in 2015 we have the need for food banks, and now you hear the stories from some of the beneficiaries.
But Seafrine Food Bank helps people who genuinely need it, and we help them with other things, not just food. On a Monday, for example, we have Leanne from Smart, who comes in from 11 to 1, who helps people with benefit advice, housing issues, debt problems, etc. Also on a Wednesday afternoon from 1 till 4, an employment advisor from Pathway comes into the food bank to assist people needing help with employment. And they do that by helping them sort their CV out to put in their CV online for employers to see. But people who use the Seafrine Food Bank, who come in while there's only the staff and volunteers present, can ask to be referred to these advisors on the beneficiary form they fill out. To reiterate, Seafrine is not just a food bank, it's also a stepping stone to better things for people who are in an unfortunate position.